Magandang araw mga ka-CSA. Ako po si Mark Rojas, 27 years of age, a registered nurse and a medical doctor. Para po sa mga hindi familiar sa akin, ako po ay regular client ni Doc Contessa dahil sa long-term treatment namin sa mga acne scars ko. Nagkaroon na po kami ng series of treatments, series of fractional lasers, LASEMD, skin boosters with dermal fillers, and even PDO inch threads po. At talagang napakalaki ng improvement na napansin na hindi lang ako yung nakapansin, kundi yung mga tao na nakapaligid din sa akin. Pero today, iba po yung gagawin namin ni Doc. Isa din siya sa mga problems namin ng mga doctors na lagi kaming napupuyat, lagi kaming kulang sa tulog. At yun nga yung droopy eyes ko. Isa itong innovation na gagawin na naman namin ni Doc dahil si Doktora ay laging merong inuuwing innovation dito sa Philippines. Excited ako na makita kung ano yung pwede niyang gawin sa mga droopy eyes o kaya yung mga parang laging pagod yung mata or yung mga malalaki yung mga eye bags. Ako, sobrang tiwala ko kay Doktora. Makikita naman dito sa mga trophies nga dito, mga certificates nga dito sa likod ko, di ba? So, samahan nyo kami na tingnan kung ano yung pwedeng gawin ni Doktora sa mga may droopy eyes.
Good day everyone, welcome to the CSA Certified Skin Authority. I'm Doc Tessa, giving you updates on the science of aesthetic medicine. So we have with us here Dr. Mark Rojas. Actually, I would like to congratulate Doc for the graduation, the commencement it was a few days ago, right? He graduated from Doctor of Medicine and he's now an incoming intern. Saang hospital ka mag-internship? Wow, congratulations. Okay. So, nag-graduate na po ang doktor natin, pero tuloy pa rin ang ating management sa kanyang condition, the so-called acne scarring on the face. And as a review, we did some procedures na fractional lasers, we did acne scar threads, we also did mga dermal fillers, we had LASEM laser, right? And right now, we're showing you yung result ng kanyang recent procedure, which was the laser. Yan. Actually, I think yung mga threads, it was like about 4 months ago. So we wanted to assess na po ano na yung naging outcome. Actually, nire-report ni Mark sa atin ngayon na nagkaroon talaga ng elevation. Especially yung sa temple region. Kasi yun yung deepest part before eh. Yung mga nasa temples, I remember sila yung nahirapan ako kasi sobrang sunken talaga. And actually dito sa side, sa right side clear na eh. Sa left side talaga, we still wanted to correct. And he's supposed to have series of lasers, fractional CO2 lasers. Actually, we haven't done a repeat ng mga lasers natin, but kasi busy ang ating doktor dahil nga sa kanyang graduation. So, we will be continuing pa with the series of fractional laser hanggang talagang maging clear yung skin ni Mark. Kasi gusto na talaga natin na makita yung magandang surface, smooth, okay, scar-free skin. And actually, ang doktor natin nagkakaroon pa po ng mga pimples. Ayan, kasi nga po, isa pa rin po siyang doktor na nagtatrabaho or nagjo-duty sa hospital and nagkakaroon ng mga puyat. Ayan. So, nagkakaroon pa rin po ng acne formation. But of course, we can manage yung acne problem. And then, dun sa scars, minimal na lang talaga. No? Shallow na. Angat na sila kasi talagang important yung mga sunken marks na mai-elevate natin. Once na nag-elevate na, pumapantay na sa surface, so it's more of just polishing na lang. Pinapakinis na lang po natin. So, we will be doing pa rin po series of fractionated CO2 lasers. Fractional CO2 laser. Yan. So, we could do that intervals of 2 to 4 weeks hanggang sa maging clear. And of course, we'll still show you yung magiging result pa po nung kanyang mga series of procedures. For now po kasi, actually, we have seen Mark na meron din pang isang concern na na-notice ko kasi sa kanya, yung eye area. Okay? In the past, we had a topic on how to treat yung mga dark circles, yung tired eyes. We had a guest, a female guest. Ngayon, we were talking about nga pag female po kasi, we're able to conceal yung mata. We're able to conceal yung pagiging tired-looking eyes using makeup. Paano naman po sa kalalakihan? Especially po ang ating mga doctors, lagi pong puyat, ayan, nagkakaroon ng sunken eyes, or dark circles, or yung iba yung concern nila yung puffy eyes, or eye bag, yan, concern nila yan. So, sipag masipag ang mga doktor po Kung sa totoo lang talagang, di ba?
Hindi natutulog, Doc. Wala tayong tulog.
We give yung sacrifice na ginagawa just to manage all our patients. Especially po yung mga hospital-based doctors natin. So, saludo po kami sa inyo. Especially yung Dr. Mark sa PGH niyan. Okay? So, paano ba natin pwedeng i-manage yung mga tired eyes, especially for men? So, anong non-surgical procedure ang pwede nating gawin? Looking at Mark right now, kasi actually a while ago I was doing an assessment sa eye area ni Mark. I noticed isang condition din, yung tinatawag na asymmetry. So actually Mark, na-notice mo na rin right now, right? Yung dun sa left side niya, wider yung eye compared dito sa right side. And then you'll notice also may sunken din infraorbital below the eye area, sunken part, or there's a so-called volume loss. So both sa sides, okay? Especially dun sa left side niya, mas sunken yung dito, and we're starting to notice yung tinatawag na Indian line. So nagkakaroon na rin ng indentation dito. And same thing on the right side. And smile nga, Mark, yan. And I also noticed na mas puffy yung dito naman sa right side niya when he smiles, right? So, well, we were discussing nga, ano ba yung cause nito? For example, bakit asymmetrical yung sa mata? Well, ano talaga, anatomically speaking, tsaka syempre genetics, pwede po talagang ganun Meron yung mga talagang hindi pantay, isang side compared sa other side, right? May iba, mas, for example, right-handed ako, kung magsulat, dominant yung right hand ko, yung iba naman left-handed, ganun. May iba naman, mas malaki yung isang side ng katawan compared sa kabila. So, sa face din, minsan yung iba, mas bulge or mas puffy ang isang side ng mukha compared sa kabila. So, there's what we call asymmetry po talaga. So, what we're gonna do will be a non-surgical procedure to correct yung tired-looking eyes and somehow also minimize yung asymmetry ng kanyang mga mata. And syempre, papasok po ng pagka-intern si Dr. Mark. Congratulations, Dr. Mark. And we're excited to give you another treatment. Of course, samahan na rin natin ng continuation ng treatment sa kanyang acne scars. And ating ipakita sa ating mga ka-CSA sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So, we have our Mark again. And we're going to treat the so-called tired-looking eyes as well as correct also the asymmetry that we have seen. I wanna add, na-notice ko kasi kanina, and probably dahil din laging puyat si Mark, yung dito sa kanyang left side, na-notice ko, merong some form of yung blepharospasm, parang twitching, or involuntary movement. Siguro deficient din ng batang to, mga B-complex vitamins yan. Common din kasi ito sa mga taong laging puyat, pagod, stress, yan, parang strain lagi din ng mata. Okay, so may nanonotice silang mga involuntary movements. Ayan, so meron din tayong pong treatment for that. Okay, for now, what we're gonna do para po ma-treat natin yung tired-looking eyes, we'll be making use of the so-called injections of dermal fillers. Yan. And the dermal filler that we will be using will be Juvederm Volbella. It is specific for the under eye area. Marami pong klase ng dermal fillers, okay? So, merong filler na for example, sa cheek area, sa chin area, sa forehead area, sa nose area. Meron ding specific for the under eye area. And iba-iba po yung characteristics ng mga fillers. So, the doctor should understand ano yung mga clinical properties ng ating mga dermal fillers. Okay? So that's very important, Doc Mark. Right? So the first step that we do actually, kanina po, we cleanse the skin already and we apply topical anesthesia. And now, we'll be starting with the dermal filler injection po. Okay. So, I will be making use of the cannula. Okay, so I will not be doing a needle technique. And then I still numb yung certain point here para sa aking entry area kung saan ko po ipapasok yung aking cannula. So, I'll be using Mark lidocaine. Okay. So, this is a different treatment for Mark right now. Actually, Mark will love this kind of treatment. Para mag-start ang kanyang internship, ayun, hindi na siya tired looking. So, yung mga patients niya will be happy to see him and yung kanyang eyes maging vibrant and full of energy. Ayan. Okay, so this is lidocaine injecting sa entry point. Okay. So, pasok lang ng lidocaine. Sorry it stings. Medyo ano lang ang lidocaine natin. Mahapdi ng konti. Ayan. And then the entry point. Okay. So, tiny entry point lang po. Inhale, exhale. Okay. And then we have our Volbella. We're using Juvederm Volbella from USA under the Allergan company. Okay, so this is a cannula. And then ito po yung entry point natin. Yan. And then towards the tear trough. So yung tawag natin dun sa may sunken part is sa tear trough area. Okay, I'll push micro-aliquot of the filler. Ayan, i-manage na rin natin yung so-called na Indian line. Okay.
Dok, ano po ba yung effect ng Indian line?
Well, Indian line, yun yung diagonal line na nagsisimula dun sa medial part ng mata, from the medial canthus, and then diagonal line siya. So, pababa ng ganyan towards this mid-cheek region. So, nagsasunken doon. Nagkakaroon ng volume loss. So, yung mga tissues na nasa loob pwedeng nag-atrophy. And also, yung ligament na nandyan nagwi-weaken. So, when we see that, we want to prevent na yung mag-worsen yung Indian line. Or lalo pa siyang maging deep. So, prevention na rin to. Now, I wanted to give Mark a so-called happy eyes. So, I can also inject filler dito sa lateral canthus ng kanyang mata. So, I'm using the same entry point. Okay. So, it's a so-called linear retrograde technique. So, pag sa entry point po, sometimes there's a so-called resistance lang. Okay. Ayan. And then, actually may, sa anatomy natin, meron tayong tinatawag na fat pad dito. Tinatawag natin yung suborbicularis fat pad. Okay, so dun lang po yung dinadaanan natin. So my cannula is going towards the lateral canthus. Okay, and I'll just inject micro-aliquot or small bolus injection lang po. Para medyo mag-lift. Kasi some people have a downturning nung corner of the eye. So, para maging happy eye, mag-inject tayo ng konting filler doon. And then, dito sa kanyang beginning Indian groove, we'll also inject a little bit. So, I'm using again the Volbella dermal filler. Okay. So, I injected about 0.4 already to 0.5. Okay. And the good thing with this filler, it's hydrophilic, it absorbs water. So, natitreat din niya yung mga dark circles and yung mga pigmentations under the eye area. Volume loss, nakakorrect din niya. Yung dull-looking skin, nakakorrect din niya. It's gonna give vibrance or radiance to your skin. So, you just have to drink a lot of water. Okay, so we'll move to the left side. So, I've mentioned a while ago, mas may problem tayo sa left side. So, we're proceeding to the left side. Okay, I did already an injection of the lidocaine and then entry point. And so, I'm using again my Volbella. Okay, so entry point here up to the tear trough. Okay, so para makorek ko na rin yung beginning Indian line ni Doc Mark. Ano bang i-specialize mo, Doc Mark?
Naku, baka sumunod ako sa yapak mo, Doc.
Oh, sige.
Para manahin ko to.
Oo, di ba?
Pero Doc, gaano katagal po yung effect nitong treatment na ginagawa natin?
Well, they did study sa filler na to. Actually, the Volbella, case-to-case basis, may iba 9 months, may ibang patients ako 12 months, andun pa. Or although may iba akong patients 6 months daw, na-dissolve na. Depending on also, ano yung environment, yung temperature around us, tapos yung activities mo, lifestyle mo. Minsan kasi mabilis ma-metabolize to pagka yung lifestyle natin, alam mo na, very unhealthy lifestyle. So, tapos kung mainit din ang panahon, yan, those are factors. Kasi this is, amino polysaccharide. So, meron pa rin siyang amino, which is the component of our protein, right? So, under heat kasi ang mga proteins, they get denatured din eh. Merong breakdown ng mga proteins. So, teka lang.
Okay lang. How about yung downtime, Doc? Lagi yung tinatanong, di ba?
Actually, after this procedure, parang wala man talagang downtime eh. Kasi the next day, like ako, I did already filler under my eye. Ang sensation lang is pakiramdam ng bugbog. Pero it doesn't look swollen, it doesn't look, or weird looking, wala naman. I can still, perform in my clinic. Nag-clinic pa rin ako. So, it's fine. Imagine, I also did my own, ear trough. Dahil nga tayong doktor, madali tayong tired eyes, di ba? Actually, this part, medyo may resistance lang. Okay. Kasi remember, we did some threads here. So, I can sense yung fibrosis. So, nagkakaroon ng mga fiber build up dito. So, medyo nahihirapan lang po. So, injecting small amount of our filler. So, ko-correct na natin yung beginning Indian line or mid-cheek groove. And I noticed kanina nagkakaroon ng twitching sa side na to. So, later on, we'll correct it with the injection of our botox or the botulinum toxin. So, dito sa side, I'll also be injecting dermal filler. Okay. So, mag-iibang entry or rather direction ako. So, parang linear direction ako niyan. Now, there's this fat pad that I will be passing by here. Yung suborbicularis fat pad. Okay? So, si Doc Mark, alam na alam din niya ang anatomy. Okay? So, dapat nagre-review ka na for the boards. Yan. Kasi po, ang pagdodoktor matagal. Ilang years na nga ba?
20.
20 years. O, yan. So, I'm already in the lateral canthus ng left eye. Okay. I need to palpate yung tip ng aking cannula and then I'll be injecting some of my filler here. Kahit mga 0.1 lang. Just to elevate that side there. And then a little bit dito sa may beginning Indian line to correct this one. Okay. So, almost. Okay. Now, after the procedure, we do ice compress. So, actually, we can do massaging doon sa filler area to spread it para maging even siya. So, this is the non-surgical way to manage tired eyes, sunken eyes, even dark circles. So, I made use of the cannula technique. Okay? Yung iba naman na ang problem is parang eye bag or puffy, we can also combine this with the eye bag threads, yung protein threads natin. So, kindly clean this area, please.
Dok, yung effect po nito, gaano katagal bago makita?
Yan. Actually, this one instant. You're gonna see now, yung kanina na sunken dito, you're gonna see it has, elevated na. So, you filled in na yung part na naging depressed or sunken. Okay. So, what we're gonna do with Mark, we'll also be continuing yung kanyang fractional CO2 laser now. Okay. We'll just be targeting yung remaining acne scars with our laser. And then also, later on, I will be injecting small amount of the botox or a micro botox para po matreat yung kanyang blepharospasm. So, treatment yon for hemifacial spasm, blepharospasm, or any involuntary movements of our muscles. Okay? And then, pag natapos ko yung series ng kanyang mga fractional lasers, again, yung mga remaining pa na marks, we'll also inject with our dermal filler. Okay? So far, so good. Okay, I can see right now a result. We can do massaging here and also a cryotherapy later on. And natin pa pong ipagpapatuloy ang ating discussion sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we have done the dermal filler. Under eye area, we use the Volbella Juvederm filler for Mark. Kamusta ang pakiramdam, Mark?
Okay naman.
Okay lang, right? So, isang point of entry lang ang ginamit natin. So, dito sa side na to, dito tayo nag-enter and then the other side doon. Okay? Na-notice ko na yung pag-angat. So, nako-correct na yung volume loss dito. Tapos, nababawasan na yung tired-looking eyes. Ayan. And as time passes by, nag-i-improve palalo because yung filler natin, it's hydrophilic, it absorbs water. So, medyo mag-ano pa yan, mag-elevate pa. And magpapantay. So, mawawala din yung parang pagka-puffy ng ating eyes. Right now, I'll be injecting small amounts of Botox. So, we call it micro Botox, baby Botox, just to correct yung kanyang may pa-konti-konting blepharospasm. Pero dapat B-complex ka rin, Doc. Alam mo naman yon. Tsaka, syempre, pahinga. Yan. And also to correct yung sobrang puffiness niya dun sa other side. And actually, the Botox, we know it's in a relaxant of the muscles, yung ating orbicularis oculi muscle, yun ang nire-relax natin. So, para hindi siya masyadong what do you call this? Yung puff, yung dito kasi when you smile, masyado siyang nagpa-puff, especially dito sa right side mo. So, usually, I give only like 1 to 2 units each side. Okay, so intradermal injection lang. Kaya-kaya na ni Doc ito. Maliit lang po. Ayan. Merixil. So, dun sa mga nagtatanong kung safe ba ang botox sa ilalim ng mata, we can give it at a very small dose. Okay?
Meron yung mga natatakot, Dok. Sabi nila parang titigas yung mukha nila.
Ayun, parang yung frozen look na tinatawag nila. So, actually, kasi pag sobra yung dose mo ng botox, parang mapaparalyze nga naman yung muscles, no? So, we only give a small amount of botox. Yung tamang-tamang marirelax lang. Kasi ang mode of action is yung natin yung if you still remember yung sa may nerve and muscle junction, yun yung tina-target nitong botox para wala nang impulse from the nerve to the muscle at hindi na magko-contract yung muscle. So you wanted to relax that muscle lang. And minimal amount lang po. Okay? Kasi the others, takot kasi akala na botox ako, tapos hindi ko na magalaw yung mukha ko, wala na akong facial expression. Yun. So, tamang amount lang para meron pa rin pong movement. Kasi ang tinitreat mo lang, gusto mo lang i-treat. Yung iba primarily kasi it's the lines, the wrinkles But for now, we wanted to reduce yung kanina nakita kong blepharospasm mo rito and also the line under the eye and also the puffiness or bulging nung under eye area. So, same thing on the other side. And para makorek na rin yung asymmetry. Kasi na-notice natin kanina medyo wider itong nasa left side ni Doc Mark. Ayan, so we did filler, we did Botox, and then after this, we have to do yung ating laser. Okay, the others kasi are asking, can you do filler and laser at the same time? Okay, since we only injected filler dun sa under eye area, now we can do laser sa ibang parts. So, ang ili-laser lang natin yung meron pang remaining na mga marks. Okay? So, hindi naman natin tatamaan yung may filler because you cannot do laser directly dun sa region where you had the filler. Okay? Kasi nga the filler might, dissolve under the extreme heat of the laser. Okay, so meron pa siyang procedure. It's the fractional laser. Okay, Doc Mark, may tanong po?
Wala na po, Doc.
Wala na, yan. Kasi ang napansin ko kay Mark, kada pumupunta siya dito, every time na nagpa-follow up siya, sabi ko nga parang yung iba na yung aura niya, naging fresher look, younger look. Kasi nga po, Lalo na mga doktor, habang tumatagal, mas tumatanda ang itsura eh. Kasi sila yung puyat, stress lagi. So, pero si Mark kabaligtaran.
Dahil sa iyo yun, Doc.
Ayun. And actually, right now kasi itong practice of medicine, it's also called regenerative medicine, yung ating aesthetic medicine. So, na-notice natin, nag-regenerate kasi yung skin cells niya. I'm really impressed, amazed, kasi we did yung PDO threads. Nag-lift po talaga dati, talaga pong lubog. Right now po, angat siya. So, a while ago, we were just talking na parang, ano na lang eh, parang discoloration na lang or pigmentation na lang eh. So, it's just a superficial layer na lang po ang aming kina-correct. The good thing is, yung lubog, naiangat na po. And yung mga nagtatanong kung po bang babalik pa ba yun sa pagkalubog, of course, na-fill in na eh. Meron nang nag-repair, meron nang nag-regenerate. So, that's already like that na po. Hindi na po siya lulubog ulit. Unless, you'll have again an inflamed acne or mga cystic acne. Yung cause ng ating acne scarring. So, mamaya po, ititreat din po namin yung kanyang pimple, okay? So, kasi po si Doc Mark, ayan pa rin. Actually po talaga, ang pimple kasi, number one cause kasi yung laging puyat or stress po talaga. So, yung mga tao ngayon, laging overwork, overfatigue, nakakakita ng acne. Kasi kahit ako, syempre marami tayong trabaho, minsan may makikita kang paisa-isang pimple dyan, but you're able to manage it and control it also naman. We will still do fractional laser, yung ating CO2 fractional laser for Mark. Okay, so amin pong ipapakita sa inyo pa yung complete result. So, tatapusin po namin itong journey. Mag-graduate din po tayo. Exactly. And maraming ang nagko-comment sa akin, nagsisend ng message na sinusubaybayan nila yung journey ni Mark. And kasi sila din daw po ay merong ganong problem. So, nakikita nila yung improvement every time we show Mark, may nakikita po silang malaking improvement po. So, ano na lang po, sa ibabaw na lang. Okay? And pag ibabaw na lang, madali na lang po yun. Okay? So, sasamahan pa natin ng yung last treatment will be the injection of the dermal filler. Okay, Mark, thank you so much. We really appreciate your time. Congratulations. Okay, so abangan po natin siya kung ano magiging specialization niya bilang doktor. Baka pagdating ng araw, siya rin po ang papalit sa akin sa mga episodes ng ating Certified Skin Authority. Okay, thank you. So, kung meron po silang katanungan, okay, you may email me at csaskinclinic@yahoo.com. We have our Facebook page, CSA Derm Centre, my FB Messenger, Contessa Salvador Alapag, Instagram, doc_Contessa. Ang aming clinic po ay matatagpuan dito sa 2nd floor, Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117, 0933-8609193, or 0917-5044268. And marami po kaming mga videos nakalagay sa aming YouTube channel, only type Contessa Salvador. And paki-click like and subscribe na rin po. Ayan, salamat po sa inyo. Salamat, Mark.
Thank you, Doc.
And really thankful din ako kay Mark kasi nga he is so patient with us sa ating management. Kasi sa totoo lang talaga, hindi naman po ito yung minsanan lang, hindi naman magic, hindi naman po yung lang, sandali ayan na yung resulta. Pero po ito naman po, nagkaroon na po kami ng outcome na maganda talaga.
Maganda.
Okay po. Yun nga lang, medyo may times na may discomfort din habang nag-i-inject. Sabi nga, no pain, no gain. Okay, so thank you so much sa inyong lahat po. God bless you all. To God be the glory always. So when it comes to natural beauty, you can trust the CSA Certified Skin Authority.